Good afternoon, everybody. This is Kelly McGregor with Atrium Health Foundation. We are just coming on to kind of welcome everybody. We're just trying to give a little friendly voice for these next few minutes before the start at 1 o'clock. So I just appreciate everybody taking the time to join us today.
Hi, Kelly.
Hey, Dr. Patel, how are you?
Doing well, thanks. How are you?
Good.
Can anybody hear me?
Hey, Courtney. Yes, I can hear you.
Hey, Courtney.
Hear anything?
We can see you.
Yep. And I see the little meter going up on your microphone.
Kelly?
Yes.
I think Courtney's having some problems.
I got it.
Oh, now.
I was like, I swear I'm not this computer illiterate. Okay.
Oh, trust me, I am though. I think I have, I don't know, I've messed so much up over the last few months. I'm just.
Oh, okay. Hi, everybody. Happy Saturday.
Happy Saturday. It's a beautiful day.
Hey, Amanda.
Hello, how are you?
Good. Thank you for getting on.
Hey, Amanda. I'm
Good
Neeraj
morning.
Patel.
Hi. Will
Nice
I
to
be
see you.
sharing my screen, or will you guys present?
So I think we'll present. I forwarded your slides to Sarah Beth, and she said that she could share the screen and she'll advance the slides for you.
Perfect. Okay. Thank you.
Welcome.
And Amanda, it's Middendorf, right? Middendorf. Am I pronouncing it correctly?
Yes, you are. It's a
Okay.
mouthful.
You know what's really sad is I'm using my son's iPad. And the other thing that's sad is I'm broadcasting from my father-in-law's closet. You can't make these things up.
I'm hiding in my daughter's room if that makes you feel better.
Amanda, how old are your kiddos now?
Grayson is 9. He'll be 10 soon. And Avery is 7.
Oh, wow, I can't believe they're that old.
I know. We've gotten so big. Avery went to a sleepover last night and told me she colored her hair. That's
Oh.
never happened before. So that's a first.
Hopefully non-permanent.
Goes with my sister, so I'm sure it's not permanent.
That's the good thing about hair. It always grows back.
It does. Thank goodness.
Our son was in fourth or fifth grade. Can't remember. Whenever the World Cup was being broadcast. So he was into soccer, and he liked this particular soccer star called Cristiano Ronaldo. And so he decided at school to dress himself up like that, which included his own haircut. So he took his front of his hair and he basically just snipped it off. And then I think he looked in the mirror and he was shocked because he did not look like Cristiano Ronaldo.
So
So then when he came home, he was too embarrassed to say anything. So he put his hand over the front of his head.
I cut my own and gave myself a mullet.
Oh my God.
And I lived in New Jersey, so it was like mullets weren't a thing up there. And my mom thought the picture was so cute that she put it on like one of those ceramic plates, and my family still to this day makes fun of me for it.
so funny. Courtney, these are all the things you get to look forward to because your son's 2, right?
Yeah, he's just under 2.
Yep.
He's so cute.
Mm-hmm.
Thank you.
The
Yeah,
other
we
thing
went, we went to the park today, and he found the joy of slides and got clobbered by an older kid because he would take too long at the bottom of the slide. So he came home with a bruise, but it was fun.
Yep.
Are you drinking water out of that cup, or it looks like Jeff's whiskey cup you got going on over there?
I guess I better specify. I'm going to put a little sign that says WATER.
Water.
You know, this is a.
I mean, you know, it's Saturday. Do what you do.
I know. Maybe it's mostly water. You know, maybe.
Yeah.
Well, if you water down your whiskey, Jeff would be mad with you.
How many people RSVP'd, Kelly?
Let me hold on 1 second. I was just looking at this. 2, 4. My eyesight is not what it used to be.
Mine either.
I think it was 39 or 40.
I think you're close to that. Yep. 1, 2, 3, 4.
That's great.
So I put a message out last night. I wanted to raise, or yesterday, I guess, 2,000 by today. Now I'm over 2,500.
Nice.
Wow.
Congratulations.
We need to learn the secret. What do you do? Like point a gun at people?
No,
Twist their
I just-
arms?
I use social media a lot, and then my mom forwards it out to like friends and family who don't do social media, who just do like email and stuff. But I think the fact that there's like no like overhead costs, you know, like all the money goes to the foundation. I think that's a big thing for people. So, and you know, people know it's my passion. It's the only thing I ever really fundraise for. So.
Well, we appreciate everything that you do.
Yes, for sure.
Do I get
was
a little
trying-
statue again if I'm the top fundraiser this
We need
year?
to- We need to talk with Sarah Beth about what we're going to do for our top fundraising gifts this year.
Yeah, I think I'm top right now for the whole walk.
What?
Wow, Terry Ann. That's
Carrie
amazing.
Ann, that is amazing.
I think so, if I'm looking at it correctly online. Yeah, the next person behind me is like $1,020 and I'm over 2,500, so
Wow, that's awesome.
yeah. I think there's gonna be some corporate, not corporate, but like job matching, you know,
Okay.
coming in too. A couple people that have donated have told me their company matches, so they were filling out that paperwork, so.
Oh, thank you. That's one thing that we try to impart with so many folks. That's the easiest way to double your gift through matching. So I appreciate you remembering that.
I was thinking about forming like part of the Indian Mafia to see if I could increase my donation.
Might help.
But you know, the Indian Mafia, unfortunately, is a group of scrawny, genetically Indian people that basically go around and they know how to play chess, but they're not really good at like contact sports.
Mm.
They're not very scary. Hey, you have a black
Not
belt,
really.
Dr. Patel.
Well, you know, I have a couple of black belts in my closet. You know, one's brown, one's black. I got some suspenders.
Well, just don't injure yourself again, because
I know,
we need a doctor.
Yes.
I think there's about 20 activities that I'm forbidden from doing from now on.
I mean,
Tennis on
can
a-
you blame?
Tennis on a cliff has to be one of them, right?
Ouch.
I'm not sure I can blame your wife.
Or I think we're all on Vandana's side with that one.
Yeah.
Yeah.
Yeah, Courtney, it was 39 that was on the list, and we're at 18 people signed on now, so that's pretty good.
Great. Are the folks who are signed on actually in the room, or are they waiting somewhere? Do you know what I mean? Like,
I know exactly what you mean. It looks as if they're all here.
okay.
Dr. Patel, confirmation, it's 19 that are on. Just a lot of folks are on mute, but they're all in the room.
Okay, great.
Dr. Patel, I'll leave it up to you if you want to, I don't know if you want to allow a couple more minutes or just in the interest of time, get started. We are recording, so we can always send out to anybody. You're on mute, Dr. Patel.
I think maybe in the interest of time, since we have some stuff to cover,
Okay.
and we want to give some time for folks to answer questions. So maybe we could go ahead and get started.
Sure.
Yeah? You want me to just go ahead and?
You can go right ahead.
Okay, all right. Well, welcome everybody. It's a little bit past 1 o'clock, so we're going to go ahead and get started. First of all, I wanted to thank the foundation for helping organize this event. I think we struggle and we do not do our best, and we certainly need the support of the foundation, and they help us shine, and we have been very successful. So shout out to Kelly McGregor and also Sarah Beth Munson for helping put this virtual event together. So thank you. And I also want to just thank all the folks who are on the Zoom meeting. I think it's time out of your all schedules. Everybody is super busy. It's a Saturday. Some of us has kids. Some of us have places to go. So thank you really for spending your time with us for an hour. And I hope that you find it educational. I hope you learn something. And most of all, this is just a very informal sort of process. I would also just like to go over the format for today. It's going to be 1 hour. I'm going to try and wrap things up by 2 o'clock. I'm going to tell you a little bit about why we're all here, a little bit about IDEA if you don't know, and we're going to celebrate a 10-year IDEA anniversary. So this event is part education and part celebration. And in that celebration, I'm going to give you a little bit of what has gone on over the last 10 years and what has IDEA really accomplished. And then we're going to talk a little bit about education. Obviously, this is a virtual event because of the times and COVID. And so I'm going to give you some updates on COVID, but particularly for the PI patient. And then we're very fortunate and honored to have Amanda Middendorf, who's a school principal, who's going to talk about school and the PI patient. And the reason why we're fortunate is she is a primary immune deficiency patient herself. And in her family and her children, she's a primary immune deficiency parent. So I'm really looking forward to her conversation. And we will also have some time at the end for questions. I know some of you had emailed me ahead of time, so we'll try and answer some of those questions, and then would love for people to give their feedback, and also would love to have folks ask questions. This is very informal, and so please, if you have a question as we're going through, you can certainly ask it. You can unmute yourself, you can type something into the chat. And so with that, we can advance to the next slide. So wanted to just take the time, we wouldn't really be an organization IDEA. We couldn't put on things like this, events, if we didn't have sponsorship and we didn't have funds to really do these programs. And not only to do those programs, but really do them well. I'd like to thank, a shout out to our flagship sponsor, Diplomat. They have really been very supportive. Many of you may know Courtney Remley. The whole Diplomat group has been there for basically every event that we've had, and they continue to shine, and we're super grateful for their support. For our gold sponsors, Horizon, I want to shout out. They have one of the, I think, one of the top education advocacy programs that I've ever seen in a company, and so shout out to Horizon, and also CSL Behring. CSL Behring has also been with IDEA since its inception, and again, we couldn't do it without many of our incredible sponsors. Next slide. And so farming, I think they've been very recent supporter, but we're very appreciative for their gold level. And then SOBI has also been a recent introduction into supporting our organization. SOBI and farming both help support our gala that occurred in February, which is one of our, which was actually the most successful fundraising that we've had in the history. And then you can see the bronze sponsors there, and I wanted to thank each of them also. All right, so just a little introduction. I think most of you know what IDEA is, but some of you may not. We have some folks who are calling in, not just from the Charlotte area, but from all over the US, so thank you for being on. IDEA stands for Immune Deficiency Education Advocacy. This was actually coined by one of our IDEA board members, Courtney Remley, and this really epitomizes what we do here in Charlotte and what this organization is about. It's first of all as a grassroots organization for primary immune deficiency. It's from really the grassroots on up, and it's for children and their families. It's for adults, all of who come together because of primary immune deficiency. It was founded in 2010. Really, actually, our first event, it was myself, and then CSL Bearing support diplomat, and at that time Baxter, and we met at a hotel, and I'll tell you a little bit about that when we get into sort of the history of IDEA. But it was very, very small. I think we had probably 17 folks total, including myself, and we've certainly grown beyond that. We're one of the pioneering organizations. There's not a whole lot of folks out there like us who are really grassroots for PI. It's amazing, you know, when I started doing this and getting more into advocacy and education, a lot of diseases that are not PI have had a lot of grassroots organizations in there, like sickle cell disease or hemophilia, and you know, there's just not a lot in PI, and so I think it's our mission really to change that. The mission, what is it? It's to advocate for patients with PI, and I'm going to show you some pictures of some things that I think you'll be pretty amazed at, how some of our own families have really advocated. It's to educate, which is part of why we're here today, and it's really to spread awareness. And we're doing it beyond the Charlotte community. We have patients that come from Florida and from Virginia and from Georgia, South Carolina. So this is now spreading, you know, beyond the Charlotte community. So, you know, we started out with 4 families in 2010, and I would say we're actually now back about 190 maybe families and counting. And I don't think that this is all related to the medical profession. I think this is really the power of the patient. And the power of the patient, I think, is so much more powerful than what we as medical providers could ever do. Next slide. So, you know, starting out in 2010, what are we, right? We are, and coming up to 2020, we are really, I would consider us an immune deficiency center of excellence. And you don't have to take this verbiage at hand. This is really based on what we have been able to accomplish. And then you can decide for yourself, hey, is this a center that is a center of excellence? So, you know, we've had fundraising events, which, again, this goes towards helping us advocate. This brings families together. This helps folks develop a relationship and not feel so isolated. We've done IDEA events, which I'll talk about in a minute, over 40 of them. We are the center for newborn screening for something called SCID, severe combined immune deficiency. We are the only center really in the greater Charlotte area that screens for this disorder. It's a fatal disorder that every newborn in North Carolina and pretty much the United States now gets screened for. And I will tell you, in the last 2 weeks, we had 2 who had bona fide severe combined immune deficiency. So it is out there. It's an amazing program, and we are happy to contribute. And the other nice thing is we do everything here in Charlotte, everything from A to Z. So not only do we diagnose patients, even when they're babies, through newborn screening, but we offer really pretty much every therapy out there. We do bone marrow transplant. We have immunoglobulin. We offer other types of really cutting edge therapies, and that's a lead into our research trials. We've had several clinical research trials. In fact, several families on this call have been benefited from clinical research studies, and these are studies you really can't get anywhere else in the US. And I'm proud to say in the last 3 studies that we participated in, we've been the top enroller for, particularly for pediatric patients, of all the US centers in the country. And these are some big heavy hitters. These are the tops of the top. The Harvards, the top Children's Hospital in the US, Children's Hospital of Philadelphia, Seattle. So, you know, we are really building ourselves to become quite a recognized center. And then we've had, obviously, an immune deficiency clinic, which most of you on this call have taken the advantage of. And I'll be especially proud just to mention that in 2019, we started a multidisciplinary clinic. And this is one of the few types of clinics in the country where we take complex PI patients and we really try and give them all of the services that really bring the power of medicine to cutting edge. So in that multidisciplinary clinic, we've had a buy-in from hematology oncology, also bone marrow transplant. So they see those specialties. They see infectious disease and immunology. They may see gastroenterology, pulmonology. And most of these folks that come to this clinic usually have obviously really bad disease, a lot of organ systems involved. And so this is a one-stop shop. You get doctors communicating with each other all in the same visit, which, as you know, doesn't happen that often. If you want to click the next slide, which will bring up some of the things that we've been able to do, Sarah Beth. So research manager says, you know, in February of 2020, we literally just got underneath the belt to do a fundraiser, and that fundraiser helped support it now, a research manager just for immunodeficiency. Next slide. We also have a mental health professional, which we didn't have before. Next slide. And then we have a dedicated social worker. So all things that really have been from fundraising. You can go ahead and click through. This is just a sort of animation, just to focus on, we can actually raise these things when we have the money, and we can put that money into ways to help advance immunodeficiency care. And as that, you'll see the PI Gala raised over $120,000. So with that, I'm going to move into the 10-year anniversary. This is really a proud moment. We had been planning to do this in the summer. COVID took over, but I want to just tell you with the next slide where we've come. So, you know, this is really a grassroots success. Over 40 events in 10 years. So we are very active. And because there's children, because there's adults in the families that act like kids, i.e. me, we try to have some fun, right? So we've had places at the Whitewater Discovery Center, Discovery Place Museum. We've had speakers from all over. We had speakers from outside of North Carolina, physicians. We've had nurses that have flown in. We have had Amanda Middendorf actually come and speak to us before, so school principal. And we've had a panel of parents come and talk one time. We've donated over 100 NFL Carolina Panthers tickets to folks who normally wouldn't have been able to go. We've supported nurses, our own nurses in the clinic, so that they can attend conferences all over the US to learn more about PI. I presented this at a national conference, and after that, there was at least 2 organizations, one in, well, actually 3, one in Utah, one in Palo Alto, California, and one in Baltimore, who decided they wanted to mimic an organization after and model that after us. We've had patients and parents lobby in Raleigh to get newborn screening approved, and then we've been featured on media, Fox News, Charlotte Today. We've even been on the Discovery Channel. Next. What about financial success? You can blow through this. And so we've raised about $20,000 annually at Hope Builders, and Kelly McGregor is going to talk a little bit about that coming up. We raised $40,000 in a silent auction, in our first silent auction in 2018, and then we raised over $120,000, which was a huge success and a huge undertaking, again, thanks to the foundation. We've had $10,000 as a grant to help increase awareness. We've had philanthropy, and then we've also given back. We've taken that money and we've given back to the ERIC Fund. The ERIC Fund was a fund that was for college-bound students. We donated $1,000 annually to let PI patients who are college-bound help defray the cost of that. And our current spending is somewhere around maybe $5,000 to $10,000 to $12,000 annually, again, to put on some of these projects. And you can clue in the next action, Sarah Beth. And for combined fundraising, I don't know if you can see that, but it's we've raised about $400,000, which has been amazing in 10 years. Okay, just wanted to tell you about what we've been doing. You've heard about clinical trials. We've had probably about 9 clinical trials over the last decade. We've had 42 enrollers. The number of clinical trials where we were the #1 enroller, which is 4, which is important because, you know, that's where pharma companies then look to us to sort of lead the way, and we get first dibs at clinical trials that come across. And I would say the number of clinical trials we've been supported, about $240,000 of funding. And then we're hoping to expand the number of research studies over the next 5 years by about 50%. Okay, I'm gonna, in the interest of time, I'll just tell you that we've published, some of you actually on this call, whether you know it or not, have been in publications. We were part of a quality of life survey that was put together in conjunction with Horizon regarding chronic granulomatous disease and autoimmunity. And again, we are some of the leading site for some of these PI studies. And you can see some of the success just from patients in the IDEA group: 4 poster presentations at national organizations, 4 abstracts, and 6 publications. Now I'm just going to give you a tour sort of the last 10 years. This is where we met in 2016 for a plasma center tour. I think this was really cool because not only did did we get to learn what goes on at Plasma Center, we also got to meet the people who donate there. And what was really cool is the donors there actually got to see folks like the children you see here, folks where, who received the plasma. And it was really neat because they donate and they could see the actual fruits of their donation and who they benefit. Next slide. This is one of the coolest advocacy pictures I've ever seen. This is the baby Carly bill. This is one of our sort of honorary members of IDEA, Stephanie Nugent, who was at the signing. Her baby had SCID and unfortunately passed away and could have been saved really from newborn screening of SCID. And that was the governor at that time. This is one of my favorite pictures, not because I'm in there, but because one of my patients is in there, and he's absolutely the cutest little kid. But when he showed up in a tuxedo, that just was like, can you all hear me? Okay, great. We can go to the next slide. Okay, and this is one of the things we did in Midtown Park called World PI Week, where we celebrate all across the world and we let balloons that honor all the PI patients worldwide. This is done through the Jeffrey Modell Foundation. A lot of fun. Next slide. And I'm going to let Kelly talk to you a little bit more about Hope Building, but this is one of our sort of annual fundraising events where we rely on donations to help run our organization. This was all the way back, I think, in like 2014 and 2015. And amazingly enough, we've actually grown from this picture. Maybe there's too many people to actually put a picture on there. I think it would just overflow and too many in there. But you can see some of these kiddos are actually like 5 or 6 years older. Some of them are on this call. Next slide. So what I decided to do, maybe for our 10-year anniversary, since we can't really do a cake, we can't raise a toast, this is a pediatric event anyway, I thought what I would do is maybe call on a few people to just say what IDEA means to you. I would really love if Terry Ann and Jana would say that. And then I'd love to open it up for those of you who've been with IDEA. If you had something you wanted to share, or why you do this, I would love to hear it. And I think other people would too. So I'm going to call actually on Terry Ann to go first.
So we were trying to come up with just one word last night, and it's actually been really hard for us to do so. The foundation has meant a tremendous amount to us. Riley was diagnosed when she was about 5, and at that time we kind of felt lost and alone and isolated. We didn't know anybody who was like her. We really didn't know where we were going to go from there. And so it's just given us hope. It's given us awareness. It's given us a sense of family. It's just, I mean, it's brought a lot to us in the amount of time that we've been a part of the organization.
Great, thanks, Terry Ann. I don't know if Jana's on the line.
Yes, I'm here. Hi, I have a similar story as Terry Ann. Alana was diagnosed when she was 4, and we were obviously not sure where to go or where to turn, and we were able to join this group and go to a lot of events and meet other people, other moms for me, other husbands for my husband, other kids for our kids, to just, I guess, kind of feel not normal, but just that we're not alone doing this. And then I was asking my family what were some of the favorite events that we've been to. My husband liked going to the Discovery Place because we really got to do something as a family, all of us. Wyatt liked the Whitewater Center. Alana can't remember. And she's the one we're doing this for. And then for me, I would say I really enjoyed doing this last gala that we did. If you could see above my head, is something that I won in an auction. I've never done a silent auction before, and actually won it. And you can see it's a zebra. It's above our bed. And then Dr. Patel was so awesome doing his bidding. It was so fun. We just had a really good time. We have a good time every event we do, and just get to enjoy everybody and kind of forget what we're going through, I guess. So I'm very thankful for this group. That's it.
Great, thank you. Does anybody else want to participate or unmute yourself or say a few words?
If I may have a second, I will tell you that 25 years ago, and I'm going to try not to cry, I lived in Charlotte, and our son was diagnosed, and we had to go to Duke, and there was nobody. Nobody knew anything about CVID, and this group is just amazing. And I wish I had had it then and take advantage of the support that's there now. We don't live there anymore, but kudos to everything you are doing, because we were lost souls. Nobody knew what Adam had or what it was about, and we had to educate everybody. So you are a blessing yourself, Dr. Patel, for being there, and all of you are so blessed to have this organization.
Thanks, Colleen. You're not supposed to make other people cry, you know.
Hi, I'm Maggie, and our son. So I've been crying too, but this is like what we've been looking for exactly. You know, we've been looking when we went to UNC. Like, you know, we've just been. They're like, well, if only you could find some parents who like were, you know, knew what you were going through. And this is exactly what we've been looking for, because nobody else understands. And like, I just get like, nobody else understands. So I'm so grateful for this. And like, I'm just so grateful for this, because this is exactly what we needed.
Thanks, Maggie. That's very sweet. I think I forgot to bring Kleenex.
Oh. Hey, this is Lori. I'm here in the Charlotte area, and Dr. Patel not only treats myself, but he treats my daughter for many years now. But I'm thankful for this group being in Charlotte as well, because I too am a child of Duke. And way back when, there just wasn't a lot of resources. So I'm just happy to be in an area that values education and moving forward and finding these different resources and drug studies and all of that. My daughter is a product of what I consider a miracle by Dr. Patel and his team stepping outside the box and just trying something different, and it's working for her. So I'm just thankful for the research that's involved with this program as well.
Thank you, Lori. Anybody else? These are tough acts to follow, I agree. Okay, well, thanks everybody. That's very meaningful, and I think a lot of the people on the line are very appreciative too. We can go to the next slide. So what I wanted to do is just talk very briefly about COVID-19. I am frankly tired of COVID-19, and I'm sure many people here are too. But you know, it is here, and it is here to stay for a little while. So what I thought I would do is kind of focus on more COVID-19 and the PI patient. And I've just highlight a few things. This is not terribly you know, new material, at least this first slide, but you know, COVID-19 is a coronavirus. And for some of you that may not know, I deal with this every day because I'm also an infectious disease doctor as well as an allergist immunologist. And so I've been in now for probably on the inpatient side I did 9 weeks out of 12, which is super tiring, but you get to learn a lot and you get to treat a lot, and I got to scare a lot of people, because when, you know, people would say, oh, you work with COVID-19, they would start to back away for some reason. I don't know why. Or if I sneezed because of allergies, that was a big, you know, tip off. But anyway, COVID-19, there's actually a couple of coronaviruses that have been around in circulation, but COVID-19 is a new virus from the human coronavirus, and it causes respiratory infection. It can be a common cold. Sometimes it can be asymptomatic. You may not know, but the thing that we worry about the most is severe respiratory infections, pneumonias, and it really can be sort of multi-system. But there's an entity in children that's called multi-system inflammatory syndrome. We've actually seen quite a few cases in Charlotte, probably the most, unfortunately, out of all of the cities in North Carolina. We've had several. Fortunately, they've all done well. You may have heard of Kawasaki's disease. This is sort of a spin-off on Kawasaki's disease, not the motorcycle that you ride around in, but the actual true disorder. The incubation is somewhere between 2 and 14 days, but on average, if you're exposed, most folks develop symptoms by 5 to 6 days. But this is really, the incubation period is why you hear about 14 days of isolation. It really comes from that. And then there's ways to detect it. Used to be nasal swab was pretty much the only way, and there was a delay time, but now there's a rapid antigen test. There's also blood testing that tests to see if you've been exposed. Usually the blood testing, you had to have been exposed for at least 7 to 10 days, because that's how long it generally takes for the antibody to show up. So if you were exposed, you know, a couple of days ago, it's likely if you did the blood antibody test, it might not show up. It used to be just supportive care for the first couple of months. Remdesivir came along. This is really the only FDA approved drug that's out there for COVID. It is under an emergency use. We have it. We're very fortunate. Levine's, and Charlotte, we've never had any lack of access. In fact, actually, we're one of 25 sites in the world. This is worldwide. Only 25 sites that are actually participating in a remdesivir trial for pediatrics. So, you know, should remdesivir become unavailable or the stock supply becomes very low, we will always have it at Levine Children's in Charlotte, because we are, you know, again, we're one of very few sites in the world to actually have approval for this this drug through the company. So we don't have to rely on emergency use at all. And I think, and unfortunately, there's no current vaccines right now, but we're going to talk a little bit about that. So next slide. So what about COVID-19 in the PI patient? I can tell you that I've done a lot of webinars already for the American College of Asthma, Allergy, Immunology about COVID and the allergist. I did one a couple months ago. There was about 640 allergists across the US that were on that call. But basically, you know, when you look at COVID-19 and PI, there ain't nothing. Sorry, this is my Kentucky accent coming out because I was born and raised in Kentucky. The only thing is that I was one of the few people that left the state of Kentucky with a full set of teeth. So I was in good shape there. Anyway, there's actually no current published studies, if you can believe that, COVID-19 and PI. I just checked yesterday. Now, I also am a reviewer for several scientific manuscripts, and you know, something did come across my desk, and I did review something about that, and I'm not supposed to say anything, but you know, there really is not anything. So what can we take away when there's nothing out there, right? So initially back in March, people and healthcare providers said, everybody who has an immune deficiency really is going to be at increased risk for morbidity and mortality. Now, whether you're immunocompetent or whether you're immune compromised, you're going to catch COVID just like anybody else. That's not what we're really talking about. We're really trying to figure out whether PI, it has an increased risk for, severe disease. And, there's anecdotal evidence both on servers that I belong to, as well as our own patients in Charlotte, that PI patients do well. I think where we struggle is where if PI patients have other comorbidities. So let's say you have an antibody deficiency, but you also have asthma. Or let's say you have an antibody deficiency, but you're greater than 65 years of age. So some of those factors count for comorbidities in of themselves. So it's kind of hard to tease out whether PI itself does. I can tell you, at least in our experience in Charlotte, we've had 4 pediatric patients that I know of who've had COVID-19. 3 of them were boys who recovered at home. 2 of them were X-linked agammaglobulinemia. 1 was CVID, and all 3 of them stayed at home quarantined, and they've done fine. We had 1 patient who was a CVID, who was a teenager, who was admitted to the ICU. Fortunately, she was not intubated. I was actually on the infectious disease service at that time, so guess who was my patient? It was her, because we were consulted as an infectious disease team. So fortunately, she did, after spending some time in the ICU, she was back on the floor. She did receive remdesivir. We also have another product that is, I forgot to mention, that is approved. It's called convalescent plasma, and that was just recently approved by the FDA to be used in COVID. It's basically where you take people who have had COVID and you take their blood and then you spin off just the antibodies to COVID and you give them to patients who have active disease. And the thought is that those antibodies then help fight the COVID infection in somebody who has no immunity to COVID. But the good news is that, at least in Charlotte, out of all the patients we've had who've either been PI or not PI, I can at least say on the pediatric side, we've never had a single death, knock on wood. And so we're extremely fortunate in that regard. And I think that just goes to show you that actually pediatric patients do very well. Pediatric patients do very well. Next slide. What about vaccines, right? We're all tired of hearing about COVID. We're all tired about social isolation and quarantine. And I think most folks agree, including CDC, is that the best chance to mitigate COVID is really when everybody has immunity. And the only way people are going to get that is really through the vaccine. Unfortunately, there's no vaccine now, but there are at least 3 or 4 companies that are in phase 3 trials. So the phase 3 trials are basically where you immunize folks and you see what is the safety, what is the efficacy. I know there's a few vaccines that are out there. I don't know a whole lot about them. One from Russia, there's one from China that's supposed to be underway. There's the possibility of herd immunity. Well, herd immunity is that, so what I think the PI patient that doesn't produce antibodies to vaccines, that's going to be a problem, right? I think some PI patients will produce a response, but I think others will not. And the idea of herd immunity, and nobody really knows whether this is going to be true for COVID yet, is that let's say you and I are protected because we've had the vaccine, but let's say my little son Johnny has PI, and either he can't get the vaccine or he gets the vaccine but he didn't respond. The way herd immunity works is just because you and I are protected, that's going to protect little Johnny. And so the idea is to try and get as many people immunized and protect so that we can protect those folks who either can't get the vaccine or who didn't respond to the vaccine. Nobody really knows when it's going to be available to the public. Obviously, this has some implication with, and even some politics, which I hate to bring up. But I think, some of the things to consider is even when a vaccine is shown to be efficacious, you still have to then talk about production. So you have to get the vaccine produced, right? You have to get millions and millions of doses, and then you have to distribute the vaccine. And so, whether it's, late this year, early next year, is still anybody's guess. Next slide. What to do for you, and I may be beating a dead horse. And if I'm beating a dead horse, this is actually good, because that's really the way that people function in society is, at least for me. My wife beats me something, you know, a couple of times and then I get it. And it's not until she beats it into me that, that I understand. So, you know, washing your hands obviously is super important, wearing your mask. And I will just say, you know, avoid touching your face because that's a #1 portal of entry. And sometimes it's hard, particularly with little kids. Social distancing. There's already reports in the Southern Hemisphere where flu was going on that social distancing actually reduced the transmission of flu, which is super important, right? If you're not around somebody, then, you know, some of the measures that have been useful for COVID have actually worked for flu in the Southern Hemisphere. So, you know, flu is coming, but I have a sneaky suspicion that flu may actually be a little less severe. Okay, so what should you do as a patient, as a parent of a patient, is you should continue your prescribed medications for PI. For some of them, it just may be wearing masks and washing hands. For others, it may be immunoglobulin. For others who have complications of PI, who have autoimmune diseases, who have, you know, who take steroids, and, you know, really you should be taking those medications as prescribed by a physician. Now, injectable medications, again, there's other immunodeficiencies like chronic granulomatous disease. You should not stop taking your medications, or if you have a reason to say, I'm going to stop taking your medications, you need to have a talk with your immunologist or with your doctor. Next slide. So what about influenza and COVID? This is the next big thing, and I think everybody needs to be cognizant. Again, what can you do? First of all, you can be aware that 1 + 1 is equal to 2, right? So you have COVID, you know, there's a good chance that both of these viruses, COVID and influenza, are going to be circulating around the same time. So 1 + 1 = 2, meaning that you get both of these viruses at the same time, your disease is going to be worse. Sometimes 1 + 1 = 3. So sometimes viruses can make things even worse. Influenza vaccine, I would encourage everybody to get the influenza vaccine injectable, particularly everybody in the household. The way you protect the PI patient, again, is for everybody in the household to get the flu vaccine. If you have symptoms of a flu-like illness, which again could be COVID too, you should seek medical attention right away. These are high fever, chills, muscle pain, because it's going to be very difficult to determine what you have unless you get medical attention, and most likely get until you get tested. And I think there's one question in the chat is, what's a good timing? You know, there's been some information about, you know, that if you get the flu vaccine too early, that your antibodies are going to wane. And really, that hasn't been, you know, the benefits of getting the flu vaccine now outweighs any possibility of the flu vaccine antibodies waning. And so there's just not enough studies to suggest that that waning of antibodies is going to be significant. And so the CDC recommends that you get the flu vaccine. And most people are getting the flu vaccine this month, but I would say certainly by the end of October, you should have your flu vaccine. That is an excellent question. So thank you. Next slide. And so with that, I want to say thank you really for listening. I know this was pretty fast. I didn't want to hog up all the time for our other speakers. And so thank you. We'll, if anybody has any pressing questions, we can take a few minutes to ask them. Otherwise, we'll move on with the program. You can either unmute yourself or you can just type something into the chat. So we'll give it maybe a minute or so.
I have a question.
Yes.
It's about time for Alana to get her HPV vaccine, or they're suggesting that. And I'm just not sure about whether, I just want to get your thoughts on if that's something that I should do for her, or we should wait, or what your thoughts are on that.
So the first question is whether there would be any harm to getting a vaccine. That's always my first answer. And for some, for some patients, they may not be able to tolerate live viral vaccines. So live viral vaccines are not currently recommended in some PI populations. HPV is a killed vaccine, so we don't have to worry about that. Some things that can affect your response to HPV vaccine can be actually administration of immune globulin. So immunoglobulin can block vaccine response. Another thing is whether you have an allergic reaction to any of the vaccine components. Most folks do not, and I would not suspect that if your child has had a full complement of vaccines, that they would have any particular reaction to HPV. My take it as an infectious disease specialist is that we don't know a lot of the immune response to certain specific vaccines. As you know, with immune deficiency, you can have some response to some vaccines, let's say diphtheria and tetanus, but you may not have response to other vaccines, let's say streptococcus pneumoniae. We don't typically measure the response for HPV, but I would say as long as there's no harm and there's a theoretical benefit, I would encourage to get as many vaccines as you can, as long as it didn't cause any harm.
Okay, so you said something about the therapy. So she does HyQvia. Would it be better to wait till like right before she does, like the week before? Does it matter?
It probably, in the long run, it probably doesn't matter. But certainly the interference of HyQvia would be the least right before the next infusion. So you're right. So if you're banking that there may be some blocking antibody, there may be a theoretical risk, but in the long term may not necessarily make a difference.
Okay.
I did get a question about when can we expect antibodies to wind up in infusion. I think that's a great question. The really antibodies, so if you think about the process of immune globulin, first of all, antibodies from COVID, there's not a lot of people who have COVID who are donating blood that's going to go to plasma. So the time to expect that to start to occur, first of all, has to occur when most of the people have immunity through vaccination. So I don't expect there to be widespread immunity until there's a vaccine. So once there's a vaccine, once people are immune, then those folks go to plasma centers and donate plasma. In general, it's usually about 6 months to a year until it winds up into products that you particularly get. So I usually tell patients about 6 months to a year from the time that something is being made to the time you actually get it. So it's actually going to be quite a while, unfortunately. And then there was a question about what do you think about traveling in December? I think, traveling there are some folks who've started to kind of, travel. I think the governor of North Carolina has put a little bit less restriction in terms of gyms, in terms of schools. I think some of that is maybe a personal question. I do think that, you have to take into things that would be into account. So you have to think about what the current circulation of the virus is. Right now, I can say, at least in North Carolina, I can't say with any other state, but in North Carolina, we're actually doing a pretty good job. The data that came out 2 weeks ago was showing that North Carolina was flattening the curve. And that 2 weeks ago data was actually from the prior 2 weeks. So they take 14 days, they see where the cases are at. So I think that's encouraging. I think you have to determine, where you're traveling to, how are you traveling? Are you going on a plane? Are you going in a car? Are you staying in a hotel? And what are the risk factors there? What I would suggest is kind of detailing your travel from the time that you set foot to the time you get there, and what are all the things you're going to do. Are you going to go to a crowded beach? Are you going to the pool? Are you traveling on a plane? And really see what makes the most sense for you. I would, if you're going to, trying to practice social distancing, wearing N95 masks. You may think about wearing gloves in certain occasions, but I think that's, ultimately, I think that's going to be, you're going to have to figure out what are the different nuances. Do I say absolutely no travel? No, but I just think it needs to be sorted out. And I think you need to think about things, particularly about how to remain safe. Hopefully that answered the question there.
So we have a quick question. We have heard that presently there are no vaccine studies being done in the pediatric category. So when a vaccine actually comes out, will you expect that who, I guess the FDA approves all that they will approve it for pediatric use without the studies actually being done? And do you recommend it for your pediatric patients without any studies?
So I think they're trying to include pediatric patients in vaccine. Anytime you do a vaccine study, the idea is to try and include a large swath of patients. Now, what they did for emergency use remdesivir is that they allowed the use, including pediatric patients, but they didn't have a lot of data on that. They didn't have, you know, the FDA normally likes to go through the safety data, but when the vaccine comes out, it's a good question. What is the age range? You know, it's hard to get the vaccine to a child if it hasn't already been approved. My gut feeling is that usually when the adult trials are going on, usually the pediatric trials soon follow. So I think when the vaccine is approved, if it's not approved for pediatrics, it soon will be. I will tell you, put in a plug, and we are going to be conducting vaccine trials in Charlotte. And I mean, you know, there's not a lot of places where you can go and be, you know, and get the vaccine study. So once Atrium gets fully on board, I'll send some information out to our group about, you know, folks, if you're interested, you can participate in the trial, and, you know, that may be a way to kind of, you know, maybe get your vaccine early. You know, you never know. So. Great. These are all great questions. Fantastic. And then, you know, if anybody thinks of questions at the end or they didn't get a chance to answer, you feel free to email me or, you know, type something or to contact me. So with that, I think we are moving forward. I will allow or ask Courtney to come and introduce our next speaker.
Okay, can everybody hear me?
Yes.
Okay, great, thanks. My name is Courtney, and I am with Diplomat Specialty Pharmacy, and it's my pleasure to introduce Dr. Amanda Mittendorf today. I've known Amanda for probably almost a decade now. She has a unique perspective. She was a teacher and an educator for approximately 7 years, and for the last almost decade has been a school assistant principal. She has her master's degree in education and most recently completed her PhD dissertation. So we're very lucky to have her and to have her volunteering her time to speak to our group today. Dr. Patel touched on this a little bit, but the other key aspect of Amanda is not only is she an expert in education as an administrator and an educator, but she is the parent of two primary immune kiddos, and she is also a primary immune patient herself. So without further ado, thank you so much for your time today, Amanda, and I will turn it over to you.
Thank you, Courtney. So as kind of Dr. Patel has said, unfortunately, we don't have all the answers in this pandemic, but I hope that my goal of this presentation is that you're able to have some tools that can help you and your family make some informed decisions now, and also hopefully whenever this pandemic ends, whenever that happens. You can go to the next slide. So I had to put a cute picture of my daughter because that's what everyone has to do. But as she said, I'm a patient myself. Have been diagnosed since I've been 20. I've done lots of different therapies. My son also is diagnosed, but he does prophylactic antibiotics. And as your mission is to give the power to the patient and that education piece, I think it's so important to kind of do what's best for your family. And so he right now is doing great with his prophylactic antibiotics daily. Avery, however, was diagnosed when she was around 1, and she has some complement defects and has been doing sub-Q therapy since then. I'm going to talk about her story in a little bit and kind of how we came to her diagnosis and how that really has impacted some decisions. At school, I have around 800 kiddos there. We have 3 school nurses, and St. Louis is obviously a big city. So we work with a lot of different pediatric allergists, immunologists in the area, just alone with our work and my work at school. We also work with a school physician, and I don't know if a lot of parents realize that schools also contract with physicians to give advice when needed. They also write general prescriptions so that we have EpiPens and things like that on hand too. So that keeps me busy as well. And go to the next. So with Avery, her story, unfortunately didn't have a very great start like many of yours did. She was in a private in-home babysitter, and there's not a lot of regulations there. She was doing an amazing job, but unfortunately she got very, very ill with rotavirus, which we know they make a vaccination. She had it 3 times for that. But someone else in the home did not have the vaccination and got it, wasn't very sick. So I always bring up considerations and your options, and to just know kind of what you're getting into, starting when your kiddos are infants. And so for us, for Grayson, a private in-home babysitter was great. But once Avery came along, we had to kind of remove her from that situation just because that wasn't going to work for us anymore. So just know that there's different licensing requirements. And now, especially during the pandemic, there's so many cleaning requirements. My preschool director joked as we were kind of going through the CDC cleaning requirements and said that she's been preparing for a pandemic forever, because that's the cleaning things that they do every day is not a big deal now, because it's just been everyday life in their preschool because they're accredited. So it kind of brought to life that making those choices, I'll admit that one preschool may be really a lot more cost effective than the other, but just kind of keep that in mind as you're making those decisions for your family. Many private schools now are making accommodations for 504s and also following IEPs even, at least they are in Missouri. But just know that unless they're getting federal funding, that they aren't required to. Again, that doesn't mean they aren't going to, but they aren't necessarily required to. Public schools, however, are bound legally to follow both IDA and 504 laws related to disabilities, and that includes our immunodeficiencies. So for my kiddos, they kind of fall in 2 different places. So they both have 504s, and that is just a legally bound document that discusses with the school and creates a plan of what they need to be successful in the day. And as it states on that 3rd bullet on the 504, it talks about how they're going to learn. For Grayson, he has 3 disabilities that it recognizes. It recognizes his asthma, his immune deficiency, and also his anxiety. And for him, it didn't really manifest and become, I guess we'll say, a concern until he felt like it was his responsibility to tell all the educators there about his asthma, when he needed to get his medication, and he didn't want to interrupt the teacher to tell her that she needed it. So he was coming home and, needing a full nebulizer treatment just because he didn't want to interrupt the teacher. So he was getting a water bottle accommodation because they've never drank out of water fountains. And so we put a couple things in there beyond that, and I'm going to list some accommodations on another page. But for Avery, she also has a 504 with some similar accommodations, but she also now has an IEP. And that is because she has what is a semi-permanent hearing loss in her right ear from ear infections that we didn't know she had. And so as a result of that, she has some speech delays. So on the 3rd bullet, it talks about how what she is learning and how she needs that specialized instruction. So there are some differences. The similarity, though, is they both have to be evaluated, and also you can request both. So if you can go to the next slide. Another confusing thing that we have in schools is a school health plan. You probably get one. We just have a general asthma plan. Schools don't really put the specifics of those in a 504 or even an IEP because they can change at the request of a physician. And they can also get clarification. Our nurses often do that. So if you see something like refer to an asthma plan or a school health plan, that's why, because they're wanting to get those specifics from the physician, which is normal. And it's specific to that diagnosis. A lot of times we have really large diabetic plans, but they also have to be signed by a doctor. Some schools want them signed by a doctor, or they won't even allow a nurse practitioner. or some do allow another medical professional. The nice thing about a school health plan compared to a 504 is that it can be easily adjusted without a big, huge meeting from everybody. So you may hear both of those discussed at the school level. You can go to the next slide. So a 504, if you feel like your school is not really meeting your kiddos' needs at any time, now during the pandemic or before now, it's again looking at how your students learning. It's not giving them any extra services from another special education teacher. It does have to limit a major life activity. Know that it's legally binding. So if you're making an accommodation, if you're requesting something for an accommodation, I always suggest you do that in an email, in a letter, and keep track of the date that you sent it. They have a certain amount of time, depending on your state, to respond. And sometimes people ask me, well, when do I know? Sometimes that's when they're absent more than other students. If they require ongoing medication that is impacting their studies, if they're missing class or things like that, or if they need modifications or accommodations that aren't necessarily available to all students. And I always kind of use the example that we're creating this plan so that if my kiddo went to another school, even though my teachers are doing it, if they went to another school, they would know exactly what that child needs to be successful. And that's why we put it in this plan. Yes, my teachers might be doing it. They're probably doing a great job at it, but we also want to make sure that other school can do it successfully as well. Know that you will also have to provide medical documentation. So like in my son's case, I had to provide for those 3 different disabilities. And then also you will have to have meetings after making the request for the 504. Okay. So here's some possible accommodations or modifications. I'm going to talk about things related to the pandemic in a little bit, but these are just general possible accommodations or modifications. So I've seen related to infections, they're allowed to go to the nurse upon request. A lot of times that might be related to other medications they're receiving. I always ask that the nurse will contact the parent after all sick visits to the office via phone. If you're one that checks your email, then maybe put email in there. I say that because a lot of nurses use like a little piece of paper or something, and I'm, trying to figure out why my kid's laying on the couch, not, asleep, and they could have had a little piece of paper in their backpack saying that they were at the nurse, 2 times, and I had no idea. I also ask that they inform me of outbreaks of communicable diseases as soon as possible, and I ask that they reach me, and it says specifically that they have to call me and on what phone number. They tried to tell me in my kiddo's case that they tell all parents via a letter, and I also gave the example that, well, it could get lost in their backpack or something, and Avery in particular is very susceptible to meningitis. So I said, I need a phone call and I want you to confirm that you reached me. You can also ask for the student area to be disinfected daily by the teacher or custodians. For absenteeism, you can ask for extended time. A lot of times in middle school, I see case managers coordinating with family on missed assignments, especially when there's a lot of different teachers involved. For health, almost all schools are having students bring water bottles right now, but that's another thing you could put in there. Able to use the restroom upon needed, and also that they're able to discreetly move away from any sick students. So if you are struggling and you've made a request and they are still saying that your kiddo doesn't need it, which I've seen before, you can contact the principal. There's also a 504 coordinator, and I always say to put any concerns in writing. The other thing is I have a school guide to primary immunodeficiency diseases from the IDF. There are actually a number of really great letters and formats in the back of here, where if you do get denied a 504, you can kind of know what to do. You can have a 504 written even without any accommodations, and it's just recognizing that your child has that disability and that the school may need to know about it. Okay. So what do we do now during this pandemic? The biggest thing is to communicate with your child's provider, their immunologist, and also the school. Make sure that you're speaking to them and every situation is so different, just like Dr. Patel has said. I know my own kiddo's immunologist went through with me the different diagnoses for all of us, and then, you know, his different concerns or not concerns with every diagnosis. Also with the school, and I say don't make assumptions, because the school, when I called in to review Grayson's 504, assumed that we weren't coming back just because we had immune deficiencies. And so I think it's important on everyone's part that you don't make assumptions. And I say that as a parent because ask questions and, you know, seek clarifications. If you're worried about how something's going to be handled at the school would much rather you ask than just assume. Know also that schools are required to follow CDC and local guidelines. So if you're worried about what those look like, I'm going to show you how to get to those in a second. Know also that you can review plans yearly, and you can ask for a review anytime as well right now. I do think too, you can go to the next slide. As a result of the pandemic, educators kind of everywhere think that there's some good things that are going to come of this. I know that my kiddos have been on homebound before. I think that our homebound services are going to be much better now than they were ever before because they have options virtual. I also think that in general, everyone's more aware of germs and things than they were ever before. So if there's some good things that come out of this, I think that will be it. On the CDC website, there's a number of really great resources for parents and also schools. This in particular talks about reviewing your school's plans, and I kind of went through this with my own kids' immunologist and really thought about, okay, are they really doing these 4 things to approach COVID-19? And so the first thing, promoting behaviors that reduce spread. Obviously, you know, we're doing social distancing. Many schools in Missouri, we have to create schedules for washing hands. We have to outline to the state that they're washing their hands 6 times a day. And also wearing obviously masks, as we've heard a lot. Now there's a mask mandate in my county, but if they're not, I would speak to your school about how that's going to look. For the second bullet point, especially ensuring proper ventilation, I do have one kiddo in my school that the mom is worried about, like, proper ventilation in gym, which is perfectly fine. They don't have to go to gym. We're still offering gym virtually. So if that's their hang up in returning, we could do gym another way. And all those other things you could definitely speak to them individually about. This last tool is also on the CDC website. And what I like about it is that as a parent, it goes through all of the kind of questions. It not just looks at the school COVID-19 aspect of things. It also has a question, it also has a number of questions about how virtual learning was going. It also asks about how your kiddo's social emotional well-being was going. So I think it asks, you know, are you in a financial place where you can stay home with your kids? And then it provides some great kind of decision-making opportunities for you. And if you still have questions, it says to reach out to the administrator. So I would definitely check that out as well if you still are not sure about returning to school. These resources, I mentioned the Immunodeficiency Foundation. I personally send the link every year of this. Again, it's the school guide for students with primary immune deficiency diseases. I make sure that the nurse at my kiddo's school has the actual copy, and then I always send the link to my kiddos' teachers so they are informed, but there's a lot of different resources on there. The Center for Disease Control and Prevention has the information that schools are going by, a ton of resources there. And then also there's the CDC decision-making tool for parents as well. I put North Carolina's Department of Health, but whatever state you're in, I would check out their health department, because that in particular is what the state is going by. We are obviously, you know, we're regulated by something. And so every state has a ton of information out there. So I would search for that. And that's kind of what your guide is. So this is my information. Feel free to use it if you have specific questions or concerns. If you're in a specific situation, I don't mind. I've probably ran through it once or twice before. So, are there any other questions? there's a question about trick-or-treating safety. I don't know if this is for you or Dr. Patel. I know for my school, for trick-or-treating, that's something we're regulated by our county. I don't know. I'll let you answer that, Dr. Patel.
Is the question about what trick-or-treating looks like? Is it, I'm not sure I understand.
I know it is on the school level, we aren't able to have a lot of those activities, so.
I guess the only thing I might add is just making sure that any activities that you do are just practiced with social distancing, making sure people have masks. I'm not sure about, that's a great question. I haven't thought a lot about trick-or-treating and the exchange that may occur and what the distancing is like and the touching of certain objects and whether they could potentially be infectious. So it would make me a little nervous, to tell you the truth, but it's a great question.
So I have a question about school. I actually emailed Dr. Patel about it and he said to ask. So our son is in elementary school. He's in a special, he has an IEP. He's in a exceptional children's or special needs class. They have 7 people in their class. North Carolina is going to go back soon with minimal social distancing for elementary schools. So luckily for him, that means that it's only going to be 7 people in his class. But we're still a little bit nervous. Like, we recognize that he really needs to be in school because of the services he receives, but also, he has these significant health risks.
Sure. I've had similar conversations really within the past week because our school is planning on returning next Thursday, kindergarten through 2nd grade, and our self-contained kiddos are returning, and it sounds like a similar room. So we've been talking to our families about getting used to masks and really building a mask tolerance is what we've been talking about. But then if they're not able to, then really thinking about what that next step is. There are some schools that have really spent a lot of time and thought into making different barriers and doing lots of different things to make those accommodations. As an administrator and also as a mom, I think it's important though that we're communicating with the parents and making sure they know what those barriers are and what they look like. I mean, I personally wouldn't want to walk in my kid's classroom and see a big plexiglass thing around them and everyone else in a mask. I'd want to know that was happening. So I think definitely speak to them and ask what their plans are for that. They may already have a plan in place, but the biggest thing that we've been talking about with our families is building what we're calling mask tolerance, building in mask breaks, and doing that positive, proactive behavior accommodation, just like we would in a normal situation. So.
That sounds awesome. I'll ask his teacher about that because they probably all could use that.
I have a quick question about the mask breaks because my daughter's school, they're not getting them like they're supposed to. And from what I understand, it's been built into one certain period of her class for 20 minutes. And she's telling me that she's in 6th grade, middle school, that they're having to beg the teacher to get the mask break. So she has asthma. So it concerns me, the asthma piece, her needing to get some fresh air, not breathing in that same mask.
Sure.
Do I go to the teacher first? Do I go to the principal? Because I know everybody's really overwhelmed right now, and I'm not want to come in and be like Mama Bear.
Yeah.
But at the same time, I'm really, really disappointed, and it makes me upset that they're having to beg for these breaks.
Yeah. So let me say the mask breaks I was talking specifically about too, like in that specific room with those special needs kiddos who have a lot of space to social distance. But most of our kiddos are getting those breaks like when they're at recess. On the CDC website, there is a specific, it's like I think 4 pages long about when to wear a mask, when not to wear a mask. And it talks about students with any health needs. And it mentions, for example, asthma. So if you are struggling with that with your daughter, I would definitely speak to the nurse first, or their teacher. I don't know if the teacher really would have the knowledge though. So I would speak to the nurse and see what their thoughts are. They may require a doctor's note depending on their county regulations. And if they do, and you need she needs that break and that accommodation, then that's a good example of what can happen, what we need to be advocating for right now.
Okay, yeah, because middle school, they don't do recess anymore. So
Exactly.
the only break that she's getting is while she's eating lunch, and in 6.5 hours.
A long time.
They're supposed to go out for 20 minutes if it's nice, and the teachers aren't doing it.
Right. Yeah.
So
I think that's a good conversation to definitely have with the nurse. And I would come armed with that information from the CDC website that, talks about sometimes they need those breaks, especially if she's asthmatic.
Okay, thank you.
Mm-hmm.
Okay, everybody, I know we still have some questions coming in, and maybe what we can do in the interest of time, we're a little over our time. And so as those questions come in, we can send a follow-up email with some of the answers to those questions. I think somebody had mentioned in the chat about there being some great information from Amanda on her presentation. I couldn't agree more. So I really just want to give out a shout out to Amanda. Thank you so much for taking your time and for giving us really important information, and especially the resources. That's amazing. So thank you. I also want to thank the foundation. Again, the foundation is vital to our group. We could really not be here where we're at without their support and without their help. So thank you, Kelly McGregor, and thank you, Sarah Beth, for both of your help and just the foundation in general. You're always there when we need you. Kelly McGregor was going to give some information on the Hope Builders, which is our upcoming fundraising event. And what I've asked her to do, or what she's willing to do, is just to send out a follow-up email with some important information and a link to sign up. We do use that. 100% of those proceeds that we raise goes straight towards our activities, our educational events. There's no overhead, which is fantastic. It all goes straight towards kids and adults with immune problems. Can't really get any better than that. Again, I want to thank our sponsors for making this a reality, but I actually want to thank more and the most really the participants here. It takes patients, it takes parents, it takes individuals to really move this forward. And you all have done exactly that. You all are interested, you all participated, you all have really seen what this organization can do and where we've come. So thank you so much for all the participants on this line. And I'll just put a shout out again. We'll probably end up doing our Hope Builders, and then maybe we'll follow up with either a late fall or an early spring event, depending on COVID and things like that. So thank you, everybody.
Thank you.
All right. Bye-bye.